help them to overcome that issue as best we can.
Yeah, Dr. Shiva, Zaid here again. My other question has two parts. Firstly, is treatment and help for mental health problems, is it available in the public institutions, or is it still exclusively in private institutions and it's not easily accessible? And secondly, how far have we reached in progress being made when we consider people mad in they have some sort of problems and you term them as mad or going to sentence, to now where we have a better understanding of it and can address it in a more civilized manner, and how it is being dealt in the workplace, which I think is your forte.
So again, thank you for an excellent question, because a lot of people, when they think of mental health treatment, that is what they think of. They think of St. Anne's, they think of the asylum, and they think that is where people go to be locked up. And maybe in the middle of the 20th century, before that, it used to be like that. But now it's no longer that way. Now the focus has switched to treating persons within their community with the help of their family and their social support network, so that we don't lock up people, as they say. There have been advances in medication that allow us to treat patients effectively in the community. And only if they should have an acute crisis, they may need to be treated in the hospital, but it's not long-term, it's just short-term for stabilization, and then they would come back out into the community. And that leads me to your first question of, are there public mental health facilities available? And there are. There are mental health clinics throughout the country. What we have done is we have decentralized out of St. Anne's, and we have put mental health clinics in different areas. So in the Southwest region, for example, there are clinics in San Fernando, in Princestown, in Siparia, in Point Fortin, and also in Couva. And what that does is it allows patients to come to the clinic closest to them, so that they don't have to travel to the hospital, which is less finances. It's easier for them. The doctors go out into the community and work with them. We have staff assigned to each region who would be familiar with the support services within that region and how we can help. And I think that a lot of people don't realize that there are these services available. So we want to, make people more aware of it so that we can reach out and help more persons. What I would suggest is, to anyone who believes that they may need some support for mental health issues, speak to either your GP or the primary care practitioner at the local health center where you live, and they should be aware of where the clinic for that area is, and they should be able to refer you there so that you can get assessed and whatever appropriate help that you can.
Yeah, Dr. Shivan, great work. My other question has to do with the treatment also, in that what we have noticed in recent years, that suicides among young people, has been on the rise. What is the connection? I imagine there would be a connection to mental health. And the other part of it is that what we have also seen is that the expertise in treating mental health problems now is required now in terms of the police service and other agencies that interact with people and in dealing with issues such as a crime, that some instances that a policeman is not required to treat in a situation that may be of domestic violence or that sort of thing in a domestic situation, when in fact a mental health expert might be the best person to handle that situation and prevent any sort of further escalation of that situation.
Okay, so to start with the question about the suicide, yes, suicide is unfortunately a very tragic endpoint of many mental health illnesses, and it is something that we are trying to decrease and not let that, become an ongoing problem. There, as you said, the increase in suicide. So I don't think that there are any hard figures or research, but what was reported was that after the closure of Petrotrin, a lot of persons who, they had loans and they suddenly lost their job and they couldn't pay the loans, they couldn't get a job anywhere else. That led to a spike in the feelings of frustration and being overwhelmed, and there were reports of persons taking their own life in that situation. Even within our current COVID situation, we have seen patients who have attempted to harm themselves, and when you speak to them, they talk about things such as financial problems because they can't work due to COVID. They talk about the stress of homeschooling. That was a very prevalent issue that was brought up when we spoke to them. So there are there's isolation, not being able to be around your loved ones and your support network. So there are several factors related to COVID that are increasing the risk for self-harm and mental health issues as a whole. The second question, in terms of the police dealing with issues that may be linked to mental health, we have been advocating for closer ties with the police, both in terms of training the police to recognize mental illness and recognize that we want to use the minimum amount of force necessary to help to get this person under control so that they can be brought for help. There are times when we would go to the police to ask for help, sometimes to bring in persons who are known to be mentally ill to the hospital. And, the level of cooperation varies based on, the police officer in question. But apart from that, the idea of the police being in a very stressful job, the idea that the police have access to weapons and that they are interacting with the public every day, you would want to institute measures where the police have a chance in an open and non-judgmental way for them to be able to receive counseling during the course of the job, and not only when something traumatic or tragic happens, so that whatever feelings of, let's say, anger or frustration that they are feeling, because we know that the police have a very hard job, and we're not minimizing that at all. It can be very tough. Sometimes, you watch on the TV and you see the police surrounded by a group of people yelling and being rowdy, and the police trying to maintain order and, remaining calm in those situations, and that's very commendable. But it does leave a mark. And, if they could have the appropriate training and the access to speak to someone about these issues, we believe that it might be very helpful for them going forward, and by extension, the way that they deal with the public.
Thank you very much, Dr. Shivan Mahabir, for your time this morning.